Hello everyone. What I'm going to announce at the conference today is a study on the development of virtual reality concepts. Let's start. I will produce with the presentation in the following orders, so you can find in this phase. First, I would like to take a look at the introduction and about virtual reality in here. Virtual reality technology is an individual to experience a realistic environment or a situation within a virtual space. Due to the rapid development of modern technology, the virtual reality technology has extensively utilized in various fields, including entertainment, gaming, medical, and education, shopping, and sports. In particularly, virtual reality research in the area of medical is increasing with the adoption of such as activities as healthcare, functional games, surgical simulation, rehabilitation training. Recently, due to the high price and ethical problems, medical requirements, and the human body are directly used in surgery and treatment training or immersed in surgery. Due to the difficulties in conducting medical education, on and on face-to-face treatment, rehabilitation training, psychology treatment, and health care, one medical staff has been able to respond to the demand for a large number of medical services. Virtual reality technology is that make it appear to interact with the real environment without having to experience environments that are difficult to experience on daily basis. Previously, it was used as surgical practice or as control training for tanks or aircraft, but HDM-type mobile devices, as it is as known as a head-mounting device also. HDM-type mobile device that can conveniently enjoy virtual reality, real-life conduct have emerged and are being applied in various fields. The size of virtual reality healthcare markets by application is in order of patient care measurement, medical training, fitness measurement, also drug arrangements. And also you can find the market by hospital, clinical, research institutes, or research pharmaceutical company, and diagnostic labs, and research labs. Let's look deeply on the ophthalmology fields among the medical fields. Various ophthalmic surgeries can be simulated through the virtual reality. There is no risk that the patient has when using the simulator to perform surgical training, and it can be performed whenever necessary, regardless of operating room situation or the patient situation, and effective feedbacks on the technique are possible. Let's look at a situation using the virtual reality in ophthalmic or ophthalmology fields. First, you can look at the use of the virtual reality in cataract surgery training. Cataract surgery training is most accomplished virtual reality-based simulators. It has most report of its effectiveness. Virtual reality can be used not only for surgery but also for various ophthalmological examination practice, especially in cases such as rectal examination, which require time and experience in proficiency. In addition, to the ophthalmological examination, generally conduct an examination that can assess the actual timing of patients and measures the quality of life can be conducted with virtual reality. Finally, you can find it in dioptic training. Dioptic training, which simulates amblyopia in the treatment of weak sight, can also be performed with virtual reality. Studies using virtual reality in HMD type are reported on the treatment or training of body and VOE and adults. Virtual reality can also be used in non-surgical treatment for symptomatic patients, just as shared treatment is done not only for weak eyesight but also for symptomatic patients. However, the research on the virtual reality and development of eye training conduct using are still insufficient. Therefore, this study aimed to develop a virtual reality conduct and present a model suited for provide more effective vision training conduct service in virtual reality. To present you with this study, we used the following method. First, the first thing is to look at the application of a virtual reality framework. In this study, we implement the virtual reality conduct used in this study experience used the unit physics engine. Unit 30 has the advantage of being available to use it on multi-platform and has very instant graphic user interface. In a virtual reality environment, the number of frames per second, as known as FPS, is very important. Or if the FPS is low, the screen does not move smoothly and may cause problems such as dizziness for the users. So it was set to 70 FPS over for implemented training conduct. In addition, Unity 3D is generally widely known as game engines but has been widely applied to fields such as academics, support conduct, and medical fields. And in 3D software, there are various tools such as 3D Max, Maya, Blender. It is mainly used not only for games but also for movies and videos. Was produced using Maya, which has the same coordinate system as Unity and application authorized game engineering. The next step is planning. In this study, a scenario was derived based on version training. When the demand for conversions turns into the demand for diversions, the content is designed so that the feedback mechanism of the float, which makes the target appear closer or farther away, can appear. In addition, localization is one of the more useful feedback codes that can be used in vision training and is related to subject's object point to the target position when fusions. And next step is 3D modeling method of conduct that will be shown in virtual realities. Polygon is basically a unit that composes of 3D objects, and when 3 vertices and connect with an edge in a 3D dimensional space on surface is created. By adjusting the point lines and planing in these ways, the desired 3D object shape was produced and modified in model of the training unit. The training content to be realized in the virtual reality space was modified in the form of the floor or boxes and the other things. which are basic form according to the basic training stage principle. Finally, you can find in material setting in mappings. Material setting in mapping was done after modeling. Mapping is to apply the 2D image to the surface of the modeling in 3D. And the texture was produced using the Photoshop on imaging authorizing tools. The create texture was applied using Microsoft programs, and desired material was created by editing the reflections on faces. Let's look at the result from this study. We set up the program follows. In order to produce the virtual reality conduct, it is important to align the size of a virtual space with the size of the actual space. The physical law in virtual space calculates the same as the real environment. So if the size of the virtual space and the real environment are different, it is customary to perform the accurate physical operations through the separate calculation process. The size of the column unit grid is 1 meter by 1 meters, and the actual world moving various track used 5 configuration sensors above the equally implemented in virtual space. In this way, 3D space in the conduct is constructed by considering the experience space of the real environment in the virtual spaces. In real life, if the user moves 1 meter to the left, the base station tracked and headset and controlled the user is wearing, and the camera in the conduct moves 1 meter to the left equally. Let's look at these figures. These figures show the main menu selection and flow charts. The start screen, we made the start screen consider the button to select the stage and play the buttons to exclude the select stage, and each menu consists of toggle buttons to select and not select the stage experience. The program allowed the user to select the stage to the experience at the stage select stage the screen, and select the level of difficulty for each stage when they go through the stage by press play. When the stage is selected, the difficulty adjustment value for each stage is set. The configuration values a group of adjusters, and look at these figures, and in the difficulty setting windows, the experience explanation windows was set according to the stage so that the experience explanation could be shown. In addition, it was programmed to show the effectiveness of training by setting different experience times by stage or difficulty levels. Let's look at these figures. These figures show that in order to train emergency capability, we eventually conduct to improve the motor sensitivities awareness of non-ways and calculated situation. It was located at 75 centimeters in difficulty level 1, and the distance in front of each difficulty level was different. In this process, lambda, the x and y values were generated from the world axis reference using random functions, and z values was various by difficulty to change the position of the boxes in which the ball was placed. Thus, the screen that the subject can see the virtual spaces that within the ball planning at the ability position in third spaces is selecting. Use the trigger buttons on the light controls and places in the hexagon frame. The shape of the movement can be estimated in advance by using various performance each type, and figure below show these figures. These results show that content is influenced so that the position of the matching markers at the bottom change every time by finding the product from the noise patterns image in the front and placing it in the right position at the bottom. Figure A show that mixed game objects in the arrow namely. Figure B show that when you look at the screen between, it can be seen the various types of shapes like as triangle, squares, and circles. So after that, when you see the screen, you can select the find of the button for the shapes. To select the shape with the track buttons of the controllers and place it on the same shaped button at the bottom. So when the select shape is the same as a button at the bottom, it is content as a correct answers. Recognition exclusions was designed as when you see the guide arrows appearance in the front time panels, align the directions of the arrows in the top, bottom, left, right direction in front of your eyes and yours in front of yours, and click the track buttons of the controller to successfully make the same shape. As the level increases, the number of guide arrows that must be adjusted increase. Let's look at the discussion and conclusion. Virtual reality is a useful technology. Various areas include the smart healthcare market currently. The most advanced virtual reality experience event provide freedom of movement. User can move in a digital environment. Virtual reality technology is actively undergoing with the industries such as education, medical, manufacturing, and even those in the field of ophthalmology used to cataract surgery training, nectar examination, and amblyopia and glaucoma. However, the population of virtual reality content for the purpose of vision training is slow. As a result, there is a lack of new visual experience available. Therefore, these studies aim to develop a virtual reality conduct and present a model suitable for provide a more efficient vision training content service in virtual reality. In this study, it is a meaningful proposed component of the model that take in account the specific of the training. All of the digital contents based on principle of vision training program. The program was designed to the minimum that's similar for the accommodation of the plane of display content. The display content is dynamic and 3D, which is common for such display content. The display partly that produce the still vision or 3D can simulate the conversions, which in turn simulate accommodation. These results are believed to be foundation research that can be expanded from a practical perspective of vision training model research, which is expected for the speculative development of model vision training content. Future study will be considered of the improved next step of vision training content for virtual realities. This study suggests the new program include the content of vision training of virtual realities. Who will be using this program? They can access to easily to training when need to and improved of visual functions. Conclusion. Developed an eye training program using the advantage of virtual reality and developed a program that can provide realistic feeling by providing sensory simulation to users for eye training as well as for training. Let's this screen as our study for the reference. The following are the reference to this study. Thank you for attention. Thank you for attention, you guys. Thank you.